Hello everybody, welcome back. This is Dr. DuPéré, plastic surgeon at the Visage Clinic in Toronto, Canada. I want to thank first my lovely lady who agreed to this filming. I thought this was an interesting procedure to discuss because we don't often do a pure neck lift. This lady had undergone already a pure isolated neck lift. She's had a browlift with me a few years ago. She presented again to the clinic a few months ago and she was concerned solely about the neck. She had the classic neck bands that we see in thin patients as we get older. Most people believe this is extra skin, but in fact, it is extra or loose muscle bands with secondary excess of skin. In the neck, we have two muscles here called the platysma. They're superficial, they're thin. They help us to grimace, to be honest. So they're from the old days when we were primates, but they're there. As we get older, the two muscles, which are normally attached in the midline, loosen. And at some point, they start hanging down. And with gravity and aging, the muscle bands get looser and down. We say ptotic or sagging. So when we hold the bands in our grandma or grandpas, we're really holding skin and muscle. So it's important when we do neck rejuvenation, especially when Our Lady here had no more angle. She was oblique with her muscle being loose. And I'll post a picture of the neck along with the video. She had neck bands loose, dehisced or separated. So it's important to reattach it in the midline first prior to pulling. If we pull and don't repair, we're going to bring the loose band on the outside, and which will be really hard to fix down the line. So she underwent today neck liposuction, deep fat removal to recreate that sharp angle that now you have the 90-degree angle. There's a tiny little bump here. This is a drain that I leave in for 24 hours. The muscle was re-tightened together, was re-stitched together as it used to be. And once this is repaired here, think of it as a hammock. It's repaired, and then I'm pulling on both sides and anchoring the muscle. The muscle goes all the way from the mouth and goes all the way to the collarbone. So I grabbed it here and I anchored it on each side. And I tell my patient it's like a hammock function, and it helps to give that 90-degree back to my lady. So neck lipo, deep fat removal that can only be done under direct vision, and muscle repair along with a muscle lift or a lower smash lift or a lower deep plane facelift, we could call it. Although there was no face component, so maybe a deep plane neck lift. This was anchored. I've used a facelift, the back of a facelift scar, which is for the neck right here. And then we have to go a little bit in the front, otherwise the earlobe gets pulled back. So there's a small incision in the front, and I put the leftover incision in her crease. The bruises are normal. She had the lipo. We just completed the procedure. She will heal those bruises in about 2 weeks, 2.5 weeks. Now you can also see that she's got aging on her face, but she was not interested. I did mention to her that we could do a lower facelift to help with the jaws, that we could do a cheek lift. She was not interested. She was happy with showing some signs of aging. As she said, she's earned them, but the neck was bothering her. Now, to help her, and because she's under general anesthesia, I suggested to add some halo laser to help with the brown spots, the fine wrinkles she has. Even after a neck lift, those lines that have been etched over many, many, many years do not go away. They get better, they get lifted, but to help with the texture, to help with the pigments, we're going to do a deep aggressive halo laser, which is a 2 laser in one. It's a hybrid laser that helps with both texture and the collagen making. Because she's under anesthesia, I can go more aggressive, give her a nice result. The aggressive halo laser will give her a 9 to 10 days recovery, but she's already recovering from the lower phase. Lower facelift again is somewhat a common procedure done with a facelift, but not often done as a single procedure. So I thought you appreciated this video of this pure isolated neck lift with halo. Thank you everybody for watching. Have a lovely day.